Hi, I'm Dr. Bert Bowden. I'm a mission ophthalmologist, and I take care of a lot of folks where we have to do small incision cataract surgery. So I want to tell you about this class that I'm putting together and how we might go about doing things and teaching you things that will help to be beneficial in many ways for you. So the idea with this is that you have to understand why you want to do small incision surgery and what do you have to gain, what do you have to lose. And of course, that's what you have to do in all of life. I want you to understand that what I'm going to be teaching and the way I'm going to be teaching is that repetition is the key to adult learning. So I'm going to tell you what I'm going to tell you. I'm going to tell you, and then I'm going to tell you what I told you. So it's important to know that background is there. So, what are the benefits of doing small incision cataract surgery? Well, the beauty is you don't hammer on the endothelium. There's not as much damage as there would be if you had a rock hard cataract and you're doing a phaco and you're just hammering away at it, and that just puts a lot of energy into the anterior chamber, and you have a lot of trouble with that as a result for the cornea. It makes the follow-up a lot easier also. For instance, if you have someone that you have to switch to a small incision cataract surgery, you don't have to do an extra cap. So it's the same as just a regular follow-up you would do for a phaco. And it makes it a whole lot easier. But the beauty of it is that you won't have a dropped nucleus again. If you're working on this, you shouldn't have that unless there's really something going on that's really bad or wrong with the zonules or wrong with the posterior capsule already. But the beauty of this is you can easily, softly, and gently remove that nucleus without any trouble. And particularly as you're having trouble with a phaco, you can switch to this and you can have that piece of nucleus or that whole nucleus come out through a small incision surgery that you wouldn't have otherwise. So here's what I'm going to teach you. One of the things is this isn't for demanding patients. Well, it's probably not anyway, because for the most part, the patients that you have that you're doing this on have rock hard, very dense cataracts. And so it's not something that they're going to be demanding pretty much anyway when you go from count fingers vision to good 20/20. That's going to be good. If they get 20/25, they're going to really be celebrating. But I want you to understand that you can do this with just an $18 instrument. And by that, I mean a Simcoe cannula, not a $100,000 machine like a phaco machine of any kind. That's the beauty of this. You don't have to have the fancy machine, but I'm going to show you how to use that. What I am going to teach you is that I've made all the mistakes that I talk about. It's not good that I have, but I've learned from that. And the beauty of it is I can teach you about them before you make those same mistakes and realize you'll never have to do extra cap again. That's the beauty of this. I'm going to show you how to convert from a small incision or from a phaco to a small incision and how you can use that small incision to help you out when you get into trouble. It's a lifesaver in many ways. So here's why I'm doing it, because there's very little of the instructions online. There's only a few YouTube videos that I found. There are some that are out there, but everybody thinks they never can do this. It's too hard, but with this course, you'll be able to understand why you're doing things. And if you have the skills to do a phaco, you certainly can do a small incision surgery. There's really nothing comprehensive out there that is available that has known good results, and that's what I'm going to provide for you. It's not available anywhere really to do, but you can't really necessarily come to Guatemala, where I've taught like 30 people down there in Guatemala how to do this kind of small incision surgery, and we continue to go and do missions there and do it. And I can come to you too. I'll talk about that more in the future here as the course progresses. I can come to you and teach you how to do it at your place. And it's pretty straightforward, actually. I've done a lot of teaching, and I can certainly do it for you. So the sequence of the learning is that we'll have a lot of videos and some written material that's there. You'll be able to take a look at what things you should do and what things you need to understand. I really want you to watch the slides and watch the videos as we put them all together. This first part is just a little introduction, but I want you to understand kind of the plan of how we're going to do it. So it's important to understand that you have to learn the order. You have to learn how to teach others too. You have to be able to teach your techs because you're going to be the one that's going, I know exactly how to do this. I'll be sure to show you exactly how to do it. They're going to be nervous, so you need to be not nervous so that you can make it easier for them. the course is going to help make you confident so that they will be also too. We're going to give you some simple things that make it a little easier for teaching the techs. If you got someone you've been working with for years, it's not a problem. But when you got a new tech that comes in and they're trying to learn this stuff, um, we're going to teach you easy things, easy ways to teach them. For instance, we don't call the Viscoat, by Viscoat or Provisc, we call it the yellow and the green. Give me the yellow stuff, give me the green stuff. They understand that real well, and you know the difference, and you can talk about cohesive or not cohesive type of viscoelastics, but they really don't care. They really want to know yellow or green. That's what makes the difference. So I want you to understand that at the end of each course, I'm gonna give you a little bit of a action item, a thing to do, a thing to think about, something. And these are the ones real simple for the first one. I really want you to just understand the plan of how we're going to proceed here, which I just talked about. We're going to ask you to set aside some time to both study, but also you're going to need some time to do this procedure and practice doing it. And I want to tell you all about how to do that. And one of the beauties of this is the way that I teach it. You can even print out the sequence and do it, or you can watch it online and do it. I have a forehead course that I've had online on YouTube since 2004, and it's real simple. Basically, you watch what you're supposed to do, put it on pause, go do that part, come back to the video, play the next part, and there's like 35 parts, something like that. And once you're done, you've finished and done a great forehead lift. So I'm going to do the same thing basically here. I'm going to make it so that you could, if you wanted to, do each individual part, come back, watch what you're supposed to do, and go to it. So I want you to understand that that's the real plan behind all of this, and I'll give you more in the future here. So that's the end of our first class, and be ready for the next class, class 2.